Okay, so today we're going to talk about Kaposi sarcoma. And we know that Kaposi sarcoma, from that sarcoma, we can think about a tumor. And importantly, it is a vascular tumor, okay? It's a vascular tumor. So Kaposi sarcoma is a vascular tumor that is rare in the United States of America. And the lesions of Kaposi sarcoma are featured by proliferation of the spindle-shaped cells that express markers of both endothelial cells and smooth muscle. So we'll talk a bit about the formation of these spindle-shaped cells later on. So in addition, Kaposi sarcoma contain chronic inflammatory cell infiltrates. Many of the features of Kaposi sarcoma suggest that it is not a malignant tumor despite its ominous name, okay? There is some compelling evidence that the Kaposi sarcoma is caused by Kaposi sarcoma apis also called the human apis 8. So maybe before we proceed, I want to elaborate something a bit about this point. Remember, this Kaposi sarcoma majorly seen in patients who have HIV and AIDS. And remember that we have apis viruses, which are normally taken into latency, especially sometimes even in the ganglia. For example, the sacral ganglia and the trigeminal ganglia for HSV1 and HSV2. So what will determine the expression of this virus in terms of their clinical presentation is immunosuppression or immunocompression. So whenever a patient is suffering from HIV, you know that we have immunocompression, especially if the patient is not taking ARVs well. This can lead to the resurging of the viruses. Like one, we have the human apis 8, which is a causative agent of Kaposi sarcoma. Okay. But remember that whenever you're talking about the mechanism of the pathogenesis of this virus in terms of causing Kaposi sarcoma, most of the mechanisms are still unclear. Most of them are still unclear, okay? But remember that just like the other apis viruses that I've just talked about, we have the Kaposi sarcoma apis virus, which is HHV8, can also enter into a latent infection, okay? And the resurgence of this infection will depend on the immunocompetency state of the patient, meaning that if you're immunosuppressed, this virus will now bring about Kaposi sarcoma, which is a vascular tumor, okay? So it usually establishes a latent infection during which several proteins are produced with potential roles in stimulating spindle cell proliferation and preventing apoptosis. Remember, one of the mechanisms in which most viruses will lead to tumorigenesis is by preventing apoptosis, okay? And the prevention of apoptosis can even be caused by an important factor called the nuclear factor kappa B or kappa beta, which is very important in preventing apoptosis, okay? So this includes a viral homologue of the cyclin cell regulator cyclin D. Remember, Kaposi sarcoma can actually produce a protein which is an analog of cyclin D. And cyclin D is very important in the regulation of the cell cycle, okay? We talked about cyclin D complexing with CDK4 or 6. Form a complex which will hyperphosphorylate the RB gene, thus making it to be inactive, and this will enable the cell cycle to continue through the G1S checkpoint, okay? But again, we can have several inhibitors, for example, the p53 gene, okay? Both of which have been implicated in a lot of tumor development. In fact, the p53 gene, also called the guardian of the genome, is one of the most prevalent inhibitor that is usually found mutated in many cancer cases, okay? The spindle cells produce pro-inflammatory and angiogenic factors. Remember, for the growth of a tumor, we need to have angiogenic factors, for example, the vascular endothelial growth factor, right? Remember that the reason why the p53 gene is very important to guard the genome of a cell, number one, is via forming anti-angiogenic factors, okay? For example, thrombospondin 1 produced by the p53s are very important anti-angiogenic factors which will prevent angiogenesis by leading to a counteractive effect, which is anti-angiogenic, okay? So, however, Kaposi sarcoma infection, Kaposi sarcoma virus infection, while necessary for Kaposi sarcoma development, is also sufficient and additional cofactors are. I think this one is quite clear. A cancer is not caused by only one factor. One virus cannot cause cancer, but we need to depend on other additional factors, okay? For example, in this case, we need to have a patient being co-infected with HIV and AIDS, which will bring immunosuppression. You see, so this patient has been affected by HHV8, but this HHV8 on itself cannot cause Kaposi sarcoma, but it will depend on another cofactor, for example, HIV, which will bring immunosuppression, hence leading to widespread dissemination of Kaposi sarcoma virus, which will now lead to Kaposi sarcoma development. So here is just an image showing a patient who has Kaposi sarcoma virus, and my goodness, this guy was kind of unlucky because this presents development of Kaposi sarcoma human virus on the face. So I think you can appreciate this particular case in this patient, okay? So let us proceed. But this is one of the presentations that you can see in a patient suffering from Kaposi sarcoma virus. You can see this reddish-like swellings and lesions. So yeah, that is it. It can make you to be ugly, especially if you're a lady. People will not like, men will not follow you around. And if you are a man, your pocket will speak more. If you have a very heavy pocket, it doesn't matter if you have them. Ladies will always flow into your cup. So we have 4 clinical forms of Kaposi sarcoma. We have the classic one, and the classic form usually occurs majorly in the men of the Mediterranean and the Eastern European deserts. We have the endemic African form, and in the endemic African form, we have generalized lymph node development, okay? We have generalized lymph node development. Then we have HIV-related form occurring in patients who are not taking highly active antiretroviral therapy. So if you're infected with HIV and AIDS, it's very important that you take those drugs because they can predispose you to the HIV-related form of Kaposi sarcoma. Then again, you can have iatrogenic form. Iatrogenic form, maybe from an hospital or those who are taking care of you. This can lead to immunosuppression. Remember, iatrogenic agents can also bring upon immunosuppression. And this one can lead to the dissemination of HHV8, which can lead to Kaposi sarcoma development. So maybe just to give you a brief know-how of what this HHV8 is, because you might be wondering, HHV8 is a double-stranded enveloped DNA virus, but it has 6 major subtypes, which we want to go into right now, okay? So after affecting the endothelial cells, HHV8 usually activates the mTOR pathway. So this mTOR pathway is what we call the mammalian target of rapamycin, okay? It can also alter the cells to have mesenchymal differentiation and promote aberrant angiogenesis. So remember, this mTOR pathway is very important for cell proliferation. So if it is activated, you can already imagine what will happen to the cells. They'll keep on expanding. We'll have a clonal sort of like expansion of these cells. And this is what can slowly progress to tumor genesis, okay? Then again, we can have through immunosuppression and inflammation, HHV8 infected cells can persist and proliferate, okay, through immunosuppression and inflammation. These HHV8 infected cells usually persist and they can proliferate because this patient is not immunocompetent. If you're immunocompetent, you can easily destroy those cells, for example, by the cytotoxic T cell mediated mechanisms, okay? So we also have another important protein called the latency-associated nuclear antigen. And this latency-associated nuclear antigen, from the name latency, is usually produced by this HHV8, especially when it is latent in the body. And this LANA can bind to the P53, and whenever we have bound to the P53, we can lead to suppression of apoptosis. Remember, P53 can actually induce apoptosis in a cell that has an abnormal genome, which is beyond repair. So in case we have this latency-associated nuclear antigen, it can bind to this P53, and this one will disorient its functioning. So this is what will lead to apoptosis, okay? I hope that is clear. So LANA also usually maintains the episome, the viral episome that prevents FAS-induced programmed cell death. Remember, FAS, ligand, and FAS are very important in the entire pathway of cell division, especially the expressive pathway of cell division. Also, it will activate the nuclear factor kappa beta, which I talked about initially. And this factor is usually important, number one, in terms of preventing apoptosis. But again, it can upregulate things like the vascular endothelial growth factor and the BFGF, which is the fibroblast growth factor. Remember, one of the ways in which a tumor will sustain itself is via formation of blood vessels. And for us to have angiogenesis, also called neovascularization, we need the presence of the VEGF, called the vascular endothelial growth factor, okay? And I told you earlier on that the P53 gene is also very important in terms of producing the thrombospondin 1. Thrombospondin 1 is usually an anti-angiogenic factor, which will prevent vascular endothelial growth factor from bringing upon angiogenesis. We'll tackle much about the P53 gene and we'll appreciate its functioning, okay? So remember that this Kaposi sarcoma is usually not monoclonal. It is usually not monoclonal. Remember that most cancers are monoclonal. So this one is usually a polyclonal one because it has different clonal origins, okay? So clinically, Kaposi sarcoma is a vascular lesion. That's why we can talk about it's a vascular tumor, okay? And in such a case, it usually presents with with violaceous pink to purple plaque on the skin or mucocutaneous surface. And this purple plaque is what you had seen in this diagram. You can appreciate the purple plaques in this particular patient. They can make it to be a bit ugly. So the possible way of treating this patient is by carrying out a cyrosurgery. Maybe you are just trying to remove those lesions. Okay. So yeah, lesions may be painful and it may be associated with lymphedema. You can see these patients can even have enlarged lymph nodes, okay? And those lesions can be so painful. So there are normally 3 stages of this lesion development. They'll start just like a patch, then it will proceed to a plaque, and finally it will form a nodule, okay? So those are the 3 stages on the skin on how these lesions develop. Remember that the lesions may ulcerate or invade into the nearby structures. They might invade. I think we talked about local invasion when we're talking about benign and malignant tumor differences. So it can ulcerate and invade the nearby tissues. In addition to involving the lymph nodes, which will automatically lead to lymphedema, Kaposi sarcoma has a predilection for lung and GIT system, okay? But remember that whenever it involves the respiratory system, this patient can die due to Kaposi sarcoma. So when Kaposi sarcoma involves the respiratory system, it can be so dangerous to the patient in that the patient can die quite easily. So maybe you can talk about the treatment and management of this Kaposi sarcoma. Number 1, I've talked about the local excision, but now use a liquid nitrogen. For example, you can use this drug commonly used called vincristine. Vincristine basically will block cell growth and stop mitosis by interfering with the microtubule polymerization. Remember, one of the ways in which mitosis can take place is by the microtubules. So whenever you interfere with the microtubules, it means that we can block the cell growth. And that is one way in which this vincristine drugs is usually important as a liquid nitrogen. Number 2, we can use chemotherapy. That is quite obvious. Whenever you have cancer, chemotherapy can also be used. Also, patients who have HIV-related Kaposi sarcoma, they can be treated with ARVs, for example, HAART. This will lead to immunocompetency development in that patient, which will lead to suppression of this HHV8, the causative agent of Kaposi sarcoma. We can also use radiotherapy. We can use cyrosurgery. We can use intralesional cytotoxic chemotherapy. This is just a type of chemotherapy. So we have differential diagnosis of Kaposi sarcomas and mucocutaneous surface includes. Let me explain the concept of differential diagnosis. Remember, someone might be affected by Kaposi sarcoma, making you to present with a lot of lesions in your face, which are pinkish in color. But remember, you can also have other conditions with the same presentation. Okay, that is what we call a differential diagnosis. We can have other conditions with the same diagnosis, same as Kaposi sarcoma. For this case, we can talk about NEVI, we can talk about pyogenic granuloma, and we can talk about bacillary angiomatosis. When you are tackling the rickettsia in bacteriology, you talked about the Bartonella enselae and the Bartonella quintana. The 2 of them can cause bacillary angiomatosis. We can talk about also hemangiomas, we can talk about angiosarcoma, and we can talk about melanoma. So that's all about Kaposi sarcoma. These are the references you can use Robin's pathology at the 10th edition, and you can also use your NCBI, get further details on Kaposi sarcoma. That's all that I add.